This is Chapter 7, Module 1, Axial Skeleton and the Skull. The learning objectives of this module are 1. Identify the bones of the axial skeleton and specify their functions. 2. Identify the bones of the cranium and face and explain the significance of the markings on the individual bones. 3. Describe the structure of the orbital complex. And 4. Discuss the process of skull development and its function during childbirth. Chapter 7 deals with the bones that protect organs in the dorsal body cavity as well as in the ventral body cavities. The axial skeleton is made up of the skull, the thoracic cage, which is the ribs, the vertebral column or the spine, the sacrum, and the coccyx. These bones help to support and protect organs in the dorsal and ventral body cavities. These bones also have attachment sites for muscles that move the head, the neck, and the trunk. The skull is a complicated structure that contains many bones. The large bones of the skull are the cranial bones, and the cranium has 8 bones. The smaller bones of the skull are the facial bones, and there are 14 of those facial bones. There are also 7 associated bones in the skull. First, we'll go over the 8 cranial bones. This is a posterior view of the cranium, and one bone that we see is the occipital bone. It sits on the back of the head. There's a protrusion off the occipital bone called the occipital condyle, and this is the bump that you feel on the back of your head. On the top of your head, we have a pair of bones, the parietal bones. There's one on the left, and there's one on the right. From a superior view, we can see the occipital bone again, just a little bit of it. We can also see the parietal bones, the larger superior portion of them. And we can also see a bone on the anterior part of the skull that's called the frontal bone. So your forehead is part of the frontal bone. On a lateral view, we can see these bones again. Here's the occipital bone. Here's the parietal bone. Here's the frontal bone that helps to make up your forehead and part of your eye socket. And then here we have the temporal bone. And the temporal bone houses the opening for your ear. We also see 2 other bones. We see a portion of the sphenoid bone, and we also see a portion of the ethmoid bone. These are the 2 other bones of the cranium. Here's an anterior view of the skull. Below the frontal bone, we can see this bone at the back of the eye orbit, and that is also the sphenoid bone. So where we saw it on the lateral side was in the temporal area, but the sphenoid bone extends all the way across inside the cranium to the opposite side. So there's one bone, parts of it, where it's exposed to the outside. From this view, we can also see the ethmoid bone. Again, we can see the ethmoid bone inside the eye orbit, just a little bit of it. It is just one bone, and the rest of this bone we can see through the nasal cavity. So there is a long plate reaching down to divide the nasal cavity into a right and a left side, and that is called the perpendicular plate of the ethmoid. And we can also see these protrusions off of the bone on either side, the right and the left, and those are called concha. There are several structures that we have to know on these 8 cranial bones, but before we get to those, let's just go back over the 8 cranial bones. Let's count the cranial bones that we have. There's 1 occipital bone, there's 2 parietal bones, there's 1 frontal bone, 1 sphenoid bone, 1 ethmoid bone, and 2 temporal bones. That gives us a total of 8 cranial bones. We'll start by looking at the temporal bone. Again, this is the bone that's found on the side of your head, and we know that the ear opening is housed there. The opening to the ear is called the external acoustic meatus, so that is found in the temporal bone. Another structure that's found in the temporal bone is this large projection just posterior to that external acoustic meatus, and that is called the mastoid bone. That's the large bump that you can feel behind your ear. Another structure that we find on the temporal bone is the styloid process. The styloid process is a small projection coming off of the temporal bone. It's found between the mandible, or the lower jaw, and the mastoid process. It's very tender if you push on it. There are muscles that attach from the styloid process into the throat area. Now we'll look at the ethmoid bone again. There are 2 structures you need to know on the ethmoid bone. Again, we're seeing the ethmoid bone. It's this green bone that we can see inside the nasal passageway, and we can also see part of it in the eye orbit. In the nasal passageway, the long plate that extends down into the nasal cavity and divides that nasal cavity into a right and a left side is called the perpendicular plate of the ethmoid. Now it doesn't extend all the way down as we're seeing here. It does articulate with another bone called the vomer bone, and the perpendicular plate of the ethmoid and the vomer bone together are called the bony nasal septum. Another structure that the ethmoid bone creates are the middle nasal concha. These concha are projections off of the ethmoid bone into each of the nasal cavities. There are 3 nasal concha. There's a superior, a middle, and an inferior nasal concha. The middle nasal concha that we're seeing right here is actually part of the ethmoid bone on the right and the left. Now if we look at the sphenoid bone, we can see the sphenoid bone in the temporal area, and we can also see the sphenoid bone at the back of the eye orbit. One of the structures that we need to know at the back of the eye orbit is the optic canal. This optic canal is an opening where the optic nerve penetrates through. It's coming from the brain, it penetrates through that optic canal and into the back of the eye, and it carries with it sensations of sight. Here's a different view that we haven't seen yet, and so I just wanted to show you this. It is a sagittal section cut through the skull, so we're looking at the right side of the skull on the inside, and here is that ethmoid bone again. We can see that part of it projects up into the cranium, so up into where the brain area is, and then there is a plate here which is called the crystal galli, and below that plate then we see another part of the ethmoid that's called the perpendicular plate of the ethmoid. In this view, we're looking at a superior view after the calvarium, or the cap of the cranium, has been cut off. So we're looking down into the skull. When we're looking down, first we see this large bone here, which is the sphenoid bone. To me it looks kind of like a bat. In the center of the sphenoid bone we see this structure called a sella turcica. The sella turcica is actually an indentation, kind of slopes down. Inside that sella turcica sits the pituitary gland. We can also see the foramen magnum. So the whole brain sits up here inside the skull. Extending down from the brain is a brain stem. And right when the brain stem gets through the foramen magnum, it's now called the spinal cord. We also see part of the ethmoid bone. The ethmoid bone has the crista galli and the cribiform plate. The crystal galli is the extension dividing the right and the left cribiform plates. Next I want to talk about how the 8 cranial bones fuse together. When we look at the cranial bones, we see that they come together in an area with this really jig-jaggedy area. Those are called sutures. So we see a suture here in between the parietal and the occipital bone. We see a suture that is extending around the temporal bone. We see a suture that is between the parietal bone and the frontal bone. The lambdoid suture is the suture between the occipital bone and the parietal bone. The coronal suture, like a crown, is the one between the frontal bone and the parietal bones. This is a superior view of the skull, and here we see another suture that is called the sagittal suture, and it divides the left parietal bone from the right parietal bone. We also get a clear view of the coronal suture, so like a crown, fits on top of your head between the frontal bone and the parietal bone. Now these sutures are not there at birth. At birth, the cranial bones are connected by areas of fibrous connective tissue. At birth, the cranial bones are connected by areas of fibrous connective tissue. These connections are flexible and the skull can be distorted without damage. So when the baby is going through the birthing process, the parietal bone and the frontal bone may overlap slightly, and after coming through the birth canal will then be able to go back to their original position. When we look at this, we see that there's a space then between the bones. So here we see the coronal suture, and we see it's creating a space between the frontal and the parietal bones. Here on the side we see the squamous suture, which is again wider between the parietal bones and the temporal bone. And we also see the lambdoid suture between the parietal bone and the occipital bone. Where these sutures come together, they form a larger area of fibrous tissue that are called fontanelles. We need to know where those structures are. Where the coronal suture meets the squamous suture, we have the sphenoidal fontanelle. Where the squamous suture meets the lambdoidal suture, we have the mastoid fontanelle. On this superior view, we see where the coronal suture meets up with the sagittal suture in this large fontanelle that's called the anterior fontanelle. I bet you can guess what another name for this anterior fontanelle is. It is the soft spot. The anterior fontanelle will close when the child is about 2 years of age. Prior to that, it remains open, and so you have to be careful about sharp objects in this area. The other fontanelles may close up within a month after birth. Another fontanelle that we see on this picture is called the Occipital Fontanelle. It's where the sagittal suture meets up with that lambdoidal suture. That's the end of this section on the cranial bones, and we'll continue in the next section talking about the facial bones. There are 14 different facial bones that we need to learn: the maxillary bones, the palatine bones, the nasal bones, the inferior nasal concha, the zygomatic bones, the lacrimal bones, the vomer, and the mandible. These superficial facial bones include the maxillary bone, which is the upper jaw bone, the lacrimal bone, which we see inside the eye orbit, and inside the lacrimal bone is an opening where tears flow down through and into the nasal cavity, the nasal bone, which makes up the bony portion of your nose, the zygomatic bone, which is your cheekbone, and the mandible, which is the lower jaw bone. We see these same bones on an anterior view. Here are the maxillary bones. Here is the mandible. Here we see the nasal bones. Here's the zygomatic bone, and we see the zygomatic bone also makes up part of this orbit in which the eye sits, which is called the bony orbit. And here is the lacrimal bone inside the orbit. The deep facial bones are the palatine bone, the inferior nasal concha, and the vomer. On this picture we can see the inferior nasal concha. The vomer is the inferior aspect of the bony nasal septum. There are 3 deep facial bones: the palatine bone, the inferior nasal concha, and the vomer. We can only see 2 of these. We can see the inferior nasal concha. They are a bone on their own, where the middle ones were part of the ethmoid bone. The inferior ones are their own bone. We can also see the vomer. The vomer is the inferior aspect of the bony nasal septum. So here we see it right here inside the nasal cavity. It is articulating with the longer perpendicular plate of the ethmoid bone. From an inferior view of the skull, we can see the maxilla again. The maxilla again is the lower jawbone, so we can see it here outside the teeth, and we also see it here inside the teeth, and we see that it's making up a large part of that hard palate inside your mouth. If we look right behind that, just posterior to that, we see this yellow bone here, which is called palatine bone itself. The palatine bone is its own bone and makes up the posterior aspect of the hard palate. I also want to show you some of the sinuses. The sinuses are skull bones with air-filled chambers. Here we can see the frontal sinus that's located in the frontal bone. We can also see the right sphenoid sinus, which is found in the sphenoid bone. These sinuses have 2 major functions. One is to make the bone lighter, so it's not so heavy. The second thing is that it is lined by a mucous membrane, and mucus secretion is produced, which will help clean the air as it passes by the nasal cavity on its way to the lungs. There are some other important structures that I want to show you that are not on your lab list. We can see all of these openings, which are called foramen. So we see the foramen rotundum here on each side, the foramen ovale on each side, the foramen spinosum on each side. Cranial nerves that are extending off of the brain, that's why they're called cranial nerves, will leave the brain and exit through these openings to go down into the rest of the body. This ends Chapter 7, Module 1, Axial Skeleton and the Skull.